So we had some young men want a soccer ball. So we had them help us clear this grass in front of the center. Looks good. So yeah, a little bit of work and then they can get a soccer ball. And we place these picnic tables here under our little trees because when we have patients come Tuesday and Thursday, there's usually chairs on the patio for them to sit, and then their motorbike taxis have somewhere to sit, a little bit of shade. So we decided to do that. Since rainy season's about done, although today's a bit cloudy, it's sprinkled, we thought that would be a good way to keep them separate. So yeah, still some ways to go with ideas in sustainability. But yeah, that's what it looks like. I was just over here today getting some medication for a patient that I need to send to Blantyre. He has an open fracture of his leg, so his bone is sticking out a bit. And since he's 18 and he's not quite 19, I can send him to Cure as a pediatric patient. So that's again part of our program here, palliative care. We take care of those with chronic disease, especially cancer, but we're seeing a lot more cardiac heart patients, end-stage liver patients, as the word's getting out. I came yesterday to see patients and there was a guy lying outside the gate with cardiac failure, so he was in respiratory distress from all the fluid in his heart. So he's been hospitalized, and then so we're seeing a lot more word of mouth. And then I have a new diabetic patient. He arrived yesterday. I started seeing him last week and his blood sugar was over 500, which is very bad. So today I was trying to find insulin for him. So yeah, that's part of palliative care, not just cancer patients and the dying, but we also help children and those under 18 with orthopedic issues, because it's such a big thing here. And you know, this young man is 18, and he was in a accident on a bus. They were going to go play soccer at the neighboring district. As you can see, you're walking home with me. And it was a big accident. And he has a fracture, his lower leg up to his knee. And so he's been using traditional means because there's not much resource here. So thankfully, the physical therapist called me to come see him today and assess him. And because he's not quite 19, he'll be 19 next month, I can get him to Cure to have intervention there. So that's a huge blessing. Sadly, the price of fuel is